Hello, everyone. Thank you for joining us once again at the Health and Human Rights in the Climate Crisis, Charting Challenges and Solutions Conference. My name is Josyula Lakshmi, and I'm a Senior Research Fellow at the George Institute for Global Health, India, one of the host organizations of the conference. I'd like to take this opportunity to acknowledge the other hosts of this event, the Australian Human Rights Institute at UNSW, Sydney, and the Institute on Inequalities in Global Health at the University of Southern California. At yesterday's session, experts in Australia spoke about what needs to happen across the business and political spectra to consider how domestic climate policy in Australia is influenced and what we as advocates can do about it. Cheryl Durant's remark, "It is the power of the vision, not the fear of the threat, that builds consensus," was particularly inspiring. In today's session, we zoom out into global thinking as we engage with addressing economic inequality in the face of health and climate emergencies. Over the next hour, we will explore the drivers of health inequality, in particular the unequal exposures and experiences of at-risk and marginalized communities to the impacts of climate change and the disproportionate economic health burden that they bear. First, each of our distinguished panelists will make introductory remarks, and we will follow that up with a panel discussion that will include audience questions. On audience questions, I request participants to type in questions and comments at any time during the session. Please preface your questions and comments with the name of the speaker they are directed to. If your remarks are meant for the panel in general, please type in the word panel before the remark. Our effort will be to include as many questions as possible from the audience in our discussion. In today's session, we have with us experts in diverse disciplines from around the world who have brought their thinking, experience, and expertise to bear on the issue of climate change and economic inequalities, what that relationship is, what the contributors and consequences are of that relationship, and how to tackle it, to progress to the realization of an equitable, carbon-frugal world. I will introduce the four panelists briefly. Dr. Noah Diffenbaugh, Cara J. Foundation Professor and Kimmelman Family Senior Fellow at Stanford University, has served the scholarly community in a number of roles, including as a current editor of the peer-reviewed journal Earth's Future and as editor-in-chief of the peer-reviewed journal Geophysical Research Letters from 2014 to 2018. He has also served as a lead author for the Intergovernmental Panel on Climate Change. Amol Mehra is the Director of Industry Transformation at the Laudes Foundation, where he oversees programs relating to transformation of the fashion and built environment sectors to address the dual crises of inequality and climate change. Fiona Haigh is Associate Professor and Director of the Health Equity Research and Development Unit at UNSW Sydney. Fiona is an equity-focused applied public health researcher with over 20 years of experience internationally, working with health and other sectors to strengthen the consideration of health and health equity in decision-making. She is currently developing a climate change vulnerability health impact assessment framework for health services. Dr. Paula Vivili is the Deputy Director General, Science and Capability at Pacific Community SPC. He was previously the Director of the Public Health Division at Pacific Community SPC and held this position for 6 years. This experience assisted him in his current role, providing him with an intimate knowledge of the Pacific community, its people, and partners. So we will now go on to what I'm sure will be an exciting and enlightening session. I'll begin with inviting Noah Diffenbaugh to begin his remarks.
Yeah, thanks so much. And thanks for the invitation to be on the panel, and thanks to the fellow panelists for the conversation. So I think I'll start by saying what I say on the first day of class every quarter that I teach, to the incoming undergraduate students that I teach, over the course of their adult lives. The challenge of climate change is really three interlocking grand challenges. The reality is that the world does not provide enough energy right now, not enough total energy, and certainly not enough, not equitably enough. So just the massive energy poverty that we have around the world now is a huge limitation to human development, huge limitation to human health and well-being. whether that's in terms of electrification or access to clean drinking water, to clean cooking, right, the tremendous health impacts of indoor air pollution from cooking with biomass in an enclosed space, right? So just in terms of the energy challenge, we have a huge grand challenge for supplying, depending on how you do the back of the envelope calculation, anywhere from 2 to 3 times as much energy as we provide now for a world of 9 billion people with access to modern energy resources, and much more equitably than we supply it now. The second grand challenge is that the fundamental physics of planet Earth necessitate that stabilizing the climate system requires reaching net zero emissions. Right? Global warming is essentially proportional to the total cumulative emissions. As long as we're continuing to emit greenhouse gases, we're going to continue to get more global warming and more climate change. And that's embedded in the UN Paris Agreement in terms of the aggregate emissions that are consistent with the 2 degree and 1.5 degree global warming goals. So that decarbonizing the energy system, reaching net zero emissions, that's a huge grand challenge in and of itself. But now if we're talking about substantially increasing energy supply in an energy system that is currently 85% fossil fuels, another 10% biomass, while also decarbonizing, doing both of those simultaneously is an even larger grand challenge. And number 3, we're not adapted to the climate change that's already happened. We've had about 1.1 degrees Celsius of global warming so far, and associated climate change, including increasing frequency and intensity of extreme events. We're clearly not adapted to that climate change, and we're guaranteed to have more. Right? A world of 2 degrees of warming is around twice as much global warming as the world of that we're in now. Even a world of 1.5, which is a very optimistic, ambitious goal, is still more global warming than we've already had. And the reality of extreme events is that we're going to continue to experience increasing frequency of unprecedented extreme events. So these will be nonlinear increases in these very extreme events that fall outside of our historical experience, even if the most ambitious global warming goals are achieved. So we're clearly not good at adapting to climate change. Adapting to more climate change is another grand challenge. Doing all 3 of these, increasing energy supply and broadening access, while decarbonizing the energy system and adapting to climate change, doing all 3 of those simultaneously is a huge grand challenge. I want to focus a little bit on what we're experiencing now in terms of extreme events and impacts from climate change, and what that suggests for the challenges in the future for human health and well-being. So when we look out across the world, we find that global warming has already elevated the probability of unprecedented hot events at more than 80% of the global surface area. So we're not quite in a world where every record-setting hot event is attributable to global warming, but we're getting close, right? We're already in a world of unprecedented heat and intensifying unprecedented heat. When we do that same calculation for extreme wet and extreme dry conditions, it's about half the world. So we're already in a world where record-setting unprecedented conditions are already more probable, and that's only increasing. This is having impacts, and the last that I'll focus on is work that my collaborator Marshall Burke and I have published in the last couple of years, focusing on economic inequality. So econometric work that Marshall has conducted shows that warm countries historically have tended to grow slightly slower in terms of their aggregate economic growth in warm years for those countries. And cool countries have tended to grow slightly faster. On a year-by-year basis, these are relatively small growth effects, but aggregated over decades, they're very substantial. So, for example, our calculations suggest that the per capita GDP in India is around 30% lower today than it would have been without global warming. Similarly, for Nigeria, around 30% lower today than without global warming. For Brazil, around 25% lower today than without global warming. The consequence is that not only are these countries poorer in aggregate than they would have been without global warming, but country-level economic inequality has been increased by global warming. And I'll close just with two numbers, depending on if you which measure of inequality you prefer. So for the most wealthy and least wealthy decile, the 90th ratio between 90th percentile and 10th percentile, that's about 25% larger. That gap's about 25% larger today than it would have been without global warming. And for the quintile, the 80th and 20th percentile ratios, it's about 40% larger today than it would have been without global warming. So we're already in a world where economic inequality has been exacerbated, and all of the impacts on human health and well-being associated with that, we're already experiencing those. So thank you.
Thank you, Noah. We'll move on to Amol Mehra's presentation now, and he'll speak on the human rights implications of the climate crisis and the solutions in promoting social protection that builds resilience and addresses health impacts and business responsibilities and opportunities for impact. Amol.
Yes, thank you so much. I also want to extend my thanks to the organizers of the event for this invitation, and it's great to follow Noah, who framed those three interlocking grand challenges, and then also their impact on inequality. What I'll do is just offer a bit of perspective from the sort of place we sit as Loudest Foundation, which is a new philanthropy that started about a year and a half ago, focused on addressing that dual crisis of climate and inequality. As we launched, the COVID crisis itself emerged. So we, in fact, are looking at this sort of triple crisis emerging, and how we address the health consequences of that relationship of climate and inequality is something we're very much top of mind for us across our work. So, pre-COVID, there were estimates that suggested that over 130 million people would be pushed into poverty in this decade by climate impacts. I think Noah's examples of the economic impacts in countries like India of climate over a certain period of time is a really sort of stark and should be a wake-up call for us all to think about how these issues interlink. The development and rights agenda with the climate agenda have too long lived in silos, and I think it's conversations like this that help bridge those gaps and show how these crises interlock and how they exacerbate one another. The IPCC reports have for a long time described the ways that climate impacts are increasing risk and vulnerabilities in communities. In our work in communities in India, in Bangladesh, in Cambodia, in Brazil, we certainly see how our partners on the ground who are working at the forefront of these agendas are dealing with the aftershocks or the shocks of extreme health impacts, extreme weather incidents, and how this sort of plays out in a global economy. Of course, if we look at food and agriculture, there's impacts there. If we look at apparel production, a sector that we work quite extensively in, there's huge impacts there. Let's take Bangladesh, for example, which is significantly below the water level, with sea level rises and apparel factory production hugging the coast. What's going to happen to workers there? So we really are focusing at Loudest, and I think, more broadly calling attention to the need to link agendas. And especially as we look at this month and the COP conference, really, what are the ways that we can both promote a decarbonized global economy while promoting a more equitable global economy? And for too long, the scientists and the human rights advocates have existed in these silos that has very much disserved a coherent set of policy reforms that need to be put in place. One set of those reforms that we are focusing quite a bit of our financial support for is on social protection. Now, social protection tends to be the policies and programs that are designed to reduce poverty and vulnerability. So this looks like social assistance, it's social insurance, and other labor market interventions. But the real challenge is that while around 2 trillion is spent annually on social protection, there's still a need for about 500 billion to make basic provisions of social protection a reality in developing countries. So we're seeing this huge gap in what's sort of invested in, and it really does leave a massive amount of vulnerability for communities that will and are being impacted by climate risk. So for us, we are looking at how we can call larger attention to the need for social protection to be examined, invested in by governments in a more serious manner, and linked to climate adaptation strategies as part of how governments are responding to the climate crisis. What are they doing to promote and ensure social protections exist for those communities that are going to be the most impacted by these natural disasters, this sea level rise and this heat? But then fundamentally, we're also asking, what's the role of business here? Business have sourcing relationships in many of the countries that are the most vulnerable to climate risk. So as I mentioned, Bangladesh, in Vietnam, these apparel producing countries also have risk associated by either higher temperatures or sea level rises or natural disasters. How are businesses that are sourcing from these regions appropriately engaging in due diligence behavior to address and mitigate any potential risks to rights based on sort of their sourcing locations, the places where they have factories, et cetera? And what could businesses be doing more of? This is the bell, the ominous bell that tolls when our time is running short. What could they be doing more of? And what is the responsibility of business in this regard? I will say perhaps a critique of the climate justice or climate space right now is this focus on decarbonization and net zero pledges. The worry that I have is this, while this is needed, as Noah described, the need to decarbonize, what's the answer for business in terms of how they change their business model and their business practices to lead to a more equitable economy with social protections in place? What can they do to invest in those? Because we do need both solutions to be addressed together. So I'll leave it there, and really looking forward to the discussion with the fellow panelists and the audience. Thank you.
Thank you, Amol. We will now go on to Fiona, who will present on how health impact assessments can be a tool that governments, industries, civil society, and communities can use to incorporate consideration of climate vulnerability into decision-making and planning processes, including human rights and economic inequality. Fiona Haigh.
Thank you. Kia ora. I'd like to begin by acknowledging the traditional owners of this land and the different lands that we're all on today. Today I'm sitting in the beautiful Blue Mountains just outside of Sydney on Darug and Gundagara land, and I'd like to pay my respects to their elders past and present, and any Aboriginal and Torres Strait Islander colleagues that might be with us today. So I want to focus my remarks on how we can incorporate the consideration of climate change vulnerability into decision-making planning processes. But first I want to spend a few minutes thinking about how we conceptualize climate change vulnerability in relation to health equity and human rights. And how I do this is, of course, influenced by who I am. As you might have picked up, I'm a Kiwi. I have an academic background in law and psychology with a little bit of philosophy on the side, and then postgraduate studies in public health and a PhD where I developed a human rights health impact assessment methodology. And I'm currently working with colleagues to develop a climate change vulnerability HIA framework to inform health service response. I think we've all seen and we've heard about it over the last few days how COVID has really shone a light on global health inequities and demonstrated the role that the wider determinants of health, including those social, structural, commercial, political determinants, play in creating and maintaining health inequities. You know, we've seen how insecure work, lack of sick leave, crowded living conditions, histories of colonisation, marginalisation and over-policing have exacerbated the impacts of COVID. And I think we see similar processes with climate change. There's a strong, almost overpowering relationship between the drivers of existing inequities and climate change vulnerability, or rather marginalisation. one way of thinking about both climate change and COVID is that they're syndemic. That the risk factors are intertwined, they're interactive, they're cumulative, they're interacting and exacerbating existing conditions, our existing human rights situations, the social conditions that we're living in. And these are driven by political and economic and social factors. So I'm very much aligned with what Amol was saying around that need to really think about how these things intersect and interrelate. And this leads to a vicious, some would say a wicked cycle of already existing marginalisation, poverty and vulnerability interacting then with climate change. And then when we think about climate change vulnerability, we often talk about three dimensions of it in terms of exposure. So, for example, those communities living close in low-lying areas to the sea. We talk about it in terms of sensitivity. So when we do have the exposure, some of us tend to have worse outcomes than others. They tend to be the young, the old, the already unwell. And the one that I think is particularly interesting for today is also adaptive capacity. So our ability to take action to actually protect ourselves against those climate change impacts. And when we think about these dimensions of vulnerability, they're both human rights and health equity issues. They go beyond just the right to health or the right to a clean, healthy and sustainable environment. They touch on a multitude, perhaps you could probably say all human rights. The right to housing, the right to participate in decision-making, Indigenous, women's rights. And there are also equity issues. So when I'm talking about inequities, I'm talking about those differences that are thought to be unnecessary and avoidable, but also considered unfair and unjust. So there's a values element in terms of what we think inequities are. And climate change vulnerability, it's not just because of some naturally occurring inherent characteristic of certain population groups. It's not because people are naughty and making bad behavioural choices to be poor and exposed to these. It's rather because people through our social organisations, we've decided on how resources should be distributed across society or communities globally. It's those multiple everyday policy and practice decisions of people in all sectors, including the health sector where I work. It's decisions about who gets what, how much, when and where. So these are all determined by how power is operating in our societies. So what can we do? I think we've seen during COVID that we can do things differently. We can give people money when they're unable to work. We can provide housing for people who are experiencing homelessness. We can develop vaccines within months that normally take years. So we can do things when we decide to. But how do we get those decision-making processes to consider health equity and human rights impacts of climate change? I think we need tools and approaches that go beyond describing the problem, that acknowledge, there's the bell, that acknowledge and engage with the politics of decision-making, that are solution-focused and support forward planning and explicitly consider power and who is making decisions. Yesterday we heard from Donna Green calling for a focus on solutions and saying we actually know what to do for a lot of this. We actually just have to do it. And I was I found it really interesting listening to Victor Stephenson, who was calling for changes in our research paradigms and also about the important role of Indigenous knowledge in this. And I think one approach is to build on this, is to call for the use of decision support tools such as health impact assessment to become a normal part of our planning and decision-making processes. So HIA is a structured, evidence-based and solution-focused process to predict future health consequences and develop recommendations about maximising positive and minimising negative health impacts of policies, plans, projects or programs. And so it's a process through which evidence of different kinds, interest, values, meanings are brought together into a dialogue between relevant stakeholders, such as decision makers, professionals, community members, in order to understand and anticipate the effects of change, such as a pandemic or climate change, a new infrastructure project, a policy on climate change, what impact they have on health inequalities in a population. And it helps us support the development of contextually appropriate local strategies. It prompts us to move beyond the consideration of those proximal impacts and drivers to consider the structural, systemic and wider determinants of health. And importantly, it also can identify those unintended impacts. So I think that the way we address climate change also has significant major impacts on health and economic inequality. So we need to be able to think about them as well and identify the benefits of actions and not just the negatives. And it can be a tool that can be used by decision makers such as government, but it's also a tool for communities and advocacy groups to advocate for change. And when you integrate a human rights framework into HIA, then that can also bring with it that dimension of accountability in the language of rights and responsibilities. So I'd just like to finish with a call for us for when we're thinking about how to address climate change, that we go beyond just thinking about mitigation and adaption to really make sure we've got to focus on how we can make transformational change, because I think that's the way that we actually address those drivers of health inequity as well as climate change at the same time. Thanks.
Thank you, Fiona. We'll move to Dr. Paula Vivili's presentation now. Paula.
Thank you very much. The Pacific region, as many know, is already facing significant challenges because of the climate change crisis. Despite contributing less than 0.03% to greenhouse gases, it suffers disproportionately high levels of adverse effects from climate change. The climate crisis is seen as the single greatest threat to the livelihood, security, and well-being of Pacific people. And on his first visit to the Pacific, UN Secretary General Antonio Guterres said that the Pacific Islands have unique moral authority to speak out on climate change. What impacts are we seeing already? Sea level rise and erosion impacts on low-lying atolls. Ocean acidification leads to coral bleaching and threatens food security. Salt intrusion and droughts causes water security issues. And extreme weather events cause devastation, loss of natural and economic base. And rising temperatures have given rise to health issues, including higher incidence of vector-borne illnesses such as dengue fever. There is considerable anxiety for affected communities, their future, their lives and livelihoods. Simple things like burial grounds, food security, water supply, uncertainty about the future, and poorly understood mental health impacts on children and elderly people. Over the past 10 years, the region has seen more severe tropical cyclones, including the tropical cyclone Evan in Samoa, Pam in Vanuatu, Winston and Yasa in Fiji. In absolute dollar terms, these cost between 200 and 900 US dollars, 900 million US dollars, or the equivalent of between 20 and 64% of the GDP. As you can imagine, recovering from such loss is much more difficult for Pacific developing nations than it is for others. Many of us are aware of the 2018 World Risk Index, which ranked 172 countries at risk of natural disasters. Vanuatu was number 1, and Tonga was number 2. Solomon Islands, Papua New Guinea, Fiji, and Kiribati were also among 9 island states in the top 15 nations. These nations are extremely vulnerable to cyclones, earthquakes, flooding, and sea level rise. What are we as a region doing about it? Despite all the challenges, Pacific countries are doing what they can. They haven't shied away from facing the challenges and have taken leadership at local, regional, and global level to advocate and address these issues and challenges. In 2018, our leaders passed a bold declaration in recognition that regional security needed to be extended beyond the usual definition of security, as was the intention of the original Biketawa Declaration. It needed to recognize other challenges impacting our security, including climate change, environmental challenges, water security, and even health security. Fiji was the chair of COP23 and continues to play a leading role in this area. Within Fiji, plans to relocate 63 villages, with a number already being relocated since 2012, so it's very real. The leadership advocacy for the 1.5 degrees included several Pacific countries. And at the current COP26 in Glasgow, despite the challenges of COVID-19 travel restrictions, Some Pacific countries have been able to send representatives signifying the region's willingness to be involved in discussions and be around the table. From regional organizations, our organization, Pacific Community, SPC, and Pacific Regional Environment Programs, PREP, and UNFPA are accredited to GCF and are playing an important role in ensuring Pacific countries have access to some funding support to assist them with their climate change work. COVID-19 has been a major challenge for us, but for many Pacific islands, they have used the support for COVID-19 to also benefit climate change related work. As mentioned earlier, vector-borne diseases such as dengue fever is increasingly more prevalent because of global warming. And to date, testing for dengue in country has only been possible in 5 of 22 Pacific countries. With support for COVID-19 testing, which uses the same testing platform, we are now able to test for dengue in 20 of the 22 countries. Very positive outcome indeed. It would be fair to say that Pacific countries will continue to do their best to address climate crisis. But on their own, we know these efforts will not be enough. We look forward to a time when all will see climate crisis with a human rights and equity lens to allow all to have the same chance of success going forward. Thank you very much.
Yeah, thank you, Paula, Vivili. We have now had the 4 presentations, an enlightening set of presentations, and what they've done for us is to clarify the big picture of climate change and health, particularly anthropogenic climate change and economic health. We will now move on to focusing on each speaker's presentation and directing questions to particular speakers first, and then on to the entire panel, inviting anyone to jump in and answer questions. So I will move now to Noah, and to quickly summarize his presentation, he emphasized, drew our attention to the triple challenge of energy poverty and energy inequity, the need for decarbonizing, if we have any intention or hope of addressing global warming, and the really disquieting piece of information that we are not adapted, and we have not actually been able to deal with even the 1.1 degree rise in temperature, and we have a 2 degree rise in temperature to look forward to. So we have these very informative and very disturbingly informative, actually, a piece of information that we got on climate change and the impact on health. And he also spoke about the rise in unprecedented heat events and also unprecedented wet and dry events, and told us a little bit about the exacerbated economic declines in poor countries, poor warmer countries, and the economic benefits that richer, cooler countries have had. So with this summary, I would like to ask I'd like to ask a few questions to Noah, and I'm looking for audience questions too as I speak. So Noah, did in your analyses of the different countries and the way that climate change has impacted economic inequality in them, did any countries stand out? That is to say, not conform to the norm or to your expectations based on latitude. If there were such countries that stood out, what was different about them? Was it their socio-political conditions somehow, or were their neighbors influential in some way? What made some countries not as vulnerable as you might have expected?
Well, so in the econometric analysis that was originally published by Marshall Burke, my collaborator, and his co-authors in their 2015 paper, that empirical analysis is the basis for what Marshall and I then went on and did for the historical impacts analysis. So in their original econometric analysis, there are outliers, certainly, in terms of this this kind of hill-shaped relationship that they uncover in the historical data. And there are certainly some, there are countries that have, large access to large energy resources that, are able to employ those for air conditioning, for example, if we're, in the case of severe heat. So there are outliers in that econometric analysis, and there are some hypotheses about what may be causing them to be outliers. I think the broader message is that there is a very robust effect of warm conditions having a variety of impacts, and in terms of the economic growth effects, there are a number of pathways. We have, if we look across literature, we have clear evidence of not only of the health effects of severe heat directly in terms of morbidity and mortality, but now recent evidence in the U.S. at least of elevated risk of workplace injuries associated with hot events that are not coded as being heat related, but just empirically elevated risk. Recent evidence led by my colleague Marshall work as well on mental health impacts, and including risk of suicide, so elevated risk from severe heat events. Many lines of evidence about elevated risk of interpersonal and intergroup violence associated with severe heat. The agricultural impacts of severe heat have been well documented, which have clear implications for food security and human health. So there are a variety of pathways. There are exceptions, but I think we don't. I think there are. I don't want to project a complete lack of hope, but I think that we do. The reality is that we actually don't have an example we can point to that. Well, here's the country where we can have carbon-free, sufficient energy for human well-being from a carbon-free source, and resilience to a changing climate. Like we don't have that example that I'm aware of. If anyone on the panel or in the audience wants to correct me, I'm open-minded.
Thank you. I'll ask your co-panelists if they have questions for you.
I've got one question, or maybe it's just asking you to comment and expand a little bit on whether you've looked at within country differences as well. Like, I understand the research you're talking about is related to latitude and orientation of the countries themselves, but have you looked at that kind of within country inequalities as well?
Yeah, so it turns out this is robust, and I'm citing Marshall's work again here. This is robust within countries, so analyzing the county level or district level data. This is observed within a number of countries, and then looking out into the future, also within country, elevated impacts in areas of the United States, for example, that are already hotter, and this is as a result. Exacerbates, in terms of projections of future economic impacts within the U.S., and this is work from Saul Shong and his colleagues. We're likely to see a widening of economic inequality because of these similar effects of counties that are already warmer tending to be poorer overall and having larger growth effects over the long term, and that gap between the richest counties and the poorest counties widening. So the short answer is yes, this holds up within country as well.
Great, thanks.
I'd like to ask another question, and then I will move on. So you did mention in your paper that trade had moderated the declines in economic. I mean, the economic declines in certain warm countries were actually attenuated by their trade practices. So can you comment on that a little bit?
Well, I'm not a trade economist. I'm not even an economist. But I know some and co-author with some. So I think there has been a general both a general hypothesis as well as some evidence that trade potentially can serve as a moderating effect, particularly in the agricultural for agricultural shocks. And one of the features that we're seeing with even from the global warming that's already happened, is an increase in the frequency of co-occurring shocks spatially. So when we look globally at the co-occurrence of low precipitation and severely high temperature, which we know, has, carries important risks for agriculture. So if we look at the breadbasket regions, for instance, globally, we find that the odds of co-occurring negative climate conditions have increased substantially, not just within those regions, but co-occurring. So, for example, China and India, have gone from mid 20th century essentially negligible odds that both would experience that their breadbasket regions would simultaneously experience low precipitation and severely high temperature, to now in the current climate having on the order of a 15% chance of those co-occurring simultaneously. And this is generally true across regions globally. So while trade has been seen as a moderator of volatility, we're now in a climate where we're much more likely to have co-occurring shocks than a few decades ago.
Thank you. I'll move on to ask Amol some questions now. Amol, in his introductory remarks, spoke of the need to link agendas of decarbonizing and economic development with industry participation, and the need to make social protection a reality. He spoke about how gaps in social protection leave vulnerable communities at a rising risk, and spoke about stimulating the responsibility of businesses. So, Amol, of all the dimensions of health that come to my mind when discussing the impact on economic inequity, the most prominent is occupational health. You spoke a little bit about particular sectors in which workers are at heightened risk. What are your reflections on the occupational health and safety considerations, including livelihood and employment security of workers, especially of disadvantaged communities, and the exposures and hazards that are amplified by climate change?
It's a great question. And just today, in fact, I got a notification that here in the US, the OSHA, the Labor Department's Occupational Safety and Health Administration, is looking at creating rulemaking to protect workers outdoor and indoor related to increased heat and temperature rises in the context of those impacts on workers. So I think there is this kind of this opportunity to look at these occupational health impacts that occur and to align policy towards addressing them. I think this is what really is needed in the context of the ways that governments can enact reforms, policy reforms that kind of regulate, if you will. I know that's sort of a touchy word for some, but to regulate business actors towards addressing these outcomes. I think the other thing is, like, let's just be really honest, there are governance gaps that are brought on by globalization, right? So we're talking about what can happen in domestic contexts, but when you're talking about an attenuated supply chain with the need for investment in these sectors, manufacturing sectors, particularly in Asia and other markets, how do we incentivize pro investment policies with pro-worker policies at the same time? I think this is a fundamental tension, and I think we need to resolve it in the context of the climate crisis. I also think, frankly, we haven't mentioned just transition here, and I'm going to give it a plug because I think it is an important framework as we think through how we migrate towards a greener economy. What does that look like, and how can we start putting into place policy prescriptions that move us in that direction while we ensure that transition leaves no one behind? And this is why we come, again, back to the focus on social protection. So I didn't really answer your question squarely, but I did plug just transition, which I feel pretty good about.
I'm sure your happiness is shared by some others, at least the panelists. Anyone with any more questions for Amol?
Yeah, I've got a question again. You're sort of talking about governance, and we've got the role of states. We've also got companies that almost have as much power as states in some ways. I was wondering what you think about philanthropy. I think you come from a philanthropic organisation. We know that some of the big philanthropists internationally have a huge amount of power in determining how things happen. I was curious what you think about the role of philanthropy in terms of governance.
That's a great question, and something we noodle actively every day. I mean, the power of philanthropy, I mean, how do I say this? Much of current climate philanthropy is also tied to individuals who've made significant wealth through a sort of globalized economy. So let's take the Bezos Earth Fund, for example, tied to Jeff Bezos and Amazon. So I think the thing that I would like to emphasize is philanthropy needs to be accountable, and philanthropy also needs to be an advocate. And what that means is if we're talking about what I believe are symptoms of deeply rooted problems, climate and inequality, I believe, are symptoms of a system that leads to these negative outcomes. It's a system that values short-termism and profit at the expense of care for people and the planet. So I think really we as in the field of philanthropy also need to shine a light to our business counterparts and sort of start to say, look, if we're dealing with these crises through philanthropic dollars, how are we leveraging our business relationships to address them as well? So I think these types of challenges require, I believe, co-governance models, because governments themselves are just failing or captured or inept at addressing them. So what's the way that all of us can align on pushing in the same direction? And I think that involves honesty, accountability, and leveraging the relationships that we have. I don't know.
Yeah.
I'd love to flip that back to you, Fiona, obviously, but maybe I'll wait for your turn, and then I'll ask a question about the role of academics and policy-minded folks about where are you in this fight?
Yeah, great.
So let's do that now. I'm just going to summarize what I got from Fiona's remarks. She emphasized the need for a holistic view of health, paying attention to the social determinants of health, and the holistic view of climate change as well, and framed them as a syndemic. And she also spoke about climate change, vulnerability, and its components of exposure, sensitivity, and a debt of capacity, and how they are intricately related to human rights and equity. And not leaving us with just the problems, she spoke about some solutions, and the solution really lies in using power wisely and well, and using social organizations and the distribution of resources to lead to an equitable world. And she spoke about decision support tools for policymakers to engage with evidence and predictions, and for stakeholders to identify potential benefits and hazards of decisions and make them appropriately. So we have Amol's question, and I'll also put in my question so you can answer both then. So it's about health impact assessments, and it's really in line with what you spoke about, what you said about the vulnerability to climate change having those components. So how do health impact assessments take into account, on the one hand, the pre-existing conditions of health and its social determinants, that is to say, baseline health conditions of the communities being exposed, and on the other hand, adaptive capacity or gaps therein, the resources that these communities may have available or may have developed in order to harness and resort to. That's my question, and Amol, question is already with you.
Yeah,
so
yeah, great. So I guess, without going into the technicalities of doing an HIA, that is part of the HIA is that it's context specific. And so you do it, and you can do it at country level, but often you're doing it in a defined sort of geographic area, trying to, predict the future impacts of something. And as part of that, a key part of that is developing kind of a profile of what the existing conditions are, and also recognizing, though, the historical conditions and trends that are influencing that. And I think one of the key elements of HIA is that it's not just looking at deficits. You're also looking at, strength and capacities that are existing within a situation, and then developing, there's lots of different ways of doing it, but the idea then is that you're thinking about what are the impacts of this specific activity. So you can do like an HIA, like an overall thing, thinking about what is the climate change impacts on an area. But more typically, you'd actually be doing the HIA on something such as like a policy that's being developed around climate change, or something that's even not climate change. So, for example, some major infrastructure project that you actually incorporate thinking about how that relates to climate change. And so you are taking the existing sort of context and thinking about that, and then developing ways of modelling and predicting, working with stakeholders to develop a sort of a shared understanding of what those future impacts might be. So I don't know if that was very clear. And in terms of Amol's question about the role of academics, I think it's really key, the same as you were saying with philanthropy, that we don't distance ourselves from the impacts of our own actions, and that the idea that sort of an academic is an objective kind of, that doing research is objective. And I think, most of us have moved beyond this naive idea that, this relates back to health impact assessment as well. In the early days of health impact assessment, we tended to have this feeling like if we tell people what's wrong and give them a solution, this will result in change. It doesn't result in change because, politics, life, different values and stuff. And so I think it's really key as academics, and particularly in this area of sort of HIA, that we're really paying attention actually to the politics of what we're doing, and that we actively engage with that, and that we acknowledge it and are transparent about it, that we do actually have positions and values, and that what we're trying to do is actually trying to influence change. We're not just neutrally putting evidence out there and, walking away from it.
Thank you. We'll move on to Paula, and I'll summarize. The central message that I got from Paula's remarks was really one of justice, or lack thereof. He spoke about the wide disparity in contribution to climate change and experience of the adverse impacts of climate change, and the particular vulnerability of the Pacific countries, and emphasize the need to expand the conceptualization of security to include climate change-induced threats. Global warming is a global problem, and it's high time everyone woke up to this and looked for solutions globally. It's not something that isolated pockets of people and resources need to solve. I'm going to ask a question. This is actually a question meant for everyone in the panel, but I'm going to direct it to Paula because I think his reflections will be particularly insightful on this. In the conference so far, there have been a few discussions of colonization at various sessions. And I think that as we examine matters of equity, in particular economic inequality exacerbated by climate change, we should consider the history of colonization and how it is played through politics and socialization, a part in our engagement with the physical and economic environments, and the role that it may continue to play in communities the world over. So I invite your reflections on this.
Well, maybe the others will have a view from the other side on this as well. But I think it's what Pacific countries want to see is that people look at the issue from their lens, because we all know the challenge nowadays is that people are concerned about their own interest, which is understandable. But having an understanding on their own situation from a Pacific lens would be helpful. It would be fair to say that a lot of people that have not been to the Pacific and talk about climate change impact doesn't take very far for people from the Pacific to understand that they don't understand very much of what happens on the ground. And so, in my own lifetime, I've seen the challenges. When I was in Tonga, for instance, we had to move a hospital, 2 hospitals from their locations, because during my time of working for the Ministry of Health, the sea was during high seas and hurricanes, the water was coming to the hospital, which was not the case before. The question on colonization, unfortunately, I'm not the best person because I come from Tonga, the only country in the region not to be colonized. But I think in looking at that issue, one would hope to think that with colonization, there would be this joint understanding of wanting to support each other and looking out for each other and being able to look at it from that perspective. I mean, to some extent, it kind of talks to the audience question on Pacific countries' views of Australia's targets for net zero by 2050. I mean, the reality is Pacific leaders and former leaders have not shied away from saying to Australia that that's not good enough. You know, end of 2020, some leaders and former leaders wrote to the Prime Minister to say that they did not think Australia was doing enough. And more recently, Pacific leaders have come out to say that perhaps cutting emissions by half by 2030 is probably a better target that people should be working out. So in terms of making their view known, it's something that Pacific countries have not held back on. But as I said in my talk, it's a two-way kind of thing, yeah? And of course, we totally understand that each politician needs to do his or her role compared to what their constituency wants them to. But yeah, climate change is of course very real for us, and it's a big challenge.
Thank you. We are actually running out of time. So I'm going to have to summarize, actually bring the session to a close. I did want to ask for a wish list from all the panelists because I felt that would really spark off a lot of ideas in people, but I think we don't have the time for that. So I'll just thank you all for joining us today and say that we've come to the close of a very enlightening and thought-provoking session that I'm sure has clarified many matters in many people's mind for sure, answered many questions, some of which, but none of which have found their way to the chat box for some reason. And I'm sure that this session has also raised many other questions in people's minds and sparked off some new ideas and avenues to explore in their various roles as researchers, industry actors, and activists and community leaders. So in our grappling with climate change at intellectual and emotional levels, we've benefited from this panel, from the laying out of the climate change concepts and their association with economic inequality. It has deepened our understanding of and concern for justice and gaps thereof. We've had glimpses of potential solutions involving governments, industry stakeholders, researchers and implementers, advocates and communities, and also glimpse the rocky paths to the realization of such solutions and the vision of equity. So thank you all very much. I must speak about tomorrow's session before we actually leave. So tomorrow's session is being held at 7 a.m. Australia time. That's on the 28th of October. And that time is the 27th of October, 1 p.m. Pacific time. The session is titled Climate Change, Public Health and Human Rights, and it is going to be held in partnership with the International Journal of Environmental Research and Public Health. This session will frame the rapidly evolving state of discourse on health and human rights in climate change debates, examining global governance efforts, academic research, NGO advocacy, and youth engagement. So please make sure, as sleep and other commitments permit, to attend that session too. Thank you very much for this session. We will keep in touch to take these conversations forward as possible. Thank you very much. Bye.